This is Dr. Martina, your sexuality expert and your online sex therapist. Before I get into the topic today, I just want to make sure that you're aware that currently I'm holding sessions, therapy sessions online. So if you have any challenges, any problems, any desires to improve the quality of your sex life, you can do that in the privacy of your home. You just have to contact me via email at martina@drfausch.com. So that's that. Now I want to talk about sex, a new frontier. With the with this coronavirus challenge that we're all are faced with in the whole world, they're telling us nothing will be the same again. Nothing will be going back to normal, whatever normal means. It will be all different, and of course my question is, what does that mean about sexual behavior? So I did some research and I found that there are actually some guidelines out there that tell us what we can do and cannot do. Of course they're telling us, and I want to pass on these guidelines to you. The lowest risk, of course they're telling us that the lowest risk would be not to have sex, but of course that's not going to work because we will have sex, and therefore I think it's important that they will tell us what we can and cannot do in order to protect ourselves and others. I'm pretty sure you know by now, or hopefully you know by now, the cause of the infection. And based on the current evidence, the coronavirus, which is what causes the virus that causes COVID-19 illness, is spreads by respiratory droplets released by the person who is infected with the virus through talking, sneezing, coughing, singing, and even just breathing out. That's why masks are important and guidelines are important, because this is obviously serious. They say it is not passed through vaginal or anal intercourse. So we can have intercourse. That's a good thing. Check that off the list. They're also saying that there's currently no evidence that COVID-19 is transmitted through semen or vaginal fluids. However, since the virus has been detected in semen and feces of people who have or are recovering from the virus, they tell us to refrain from unprotected fellatio. So in other words, no blowjobs without a condom, no rimming, which is anal stimulation with a tongue without dental dam, and no cunnilingus, which is oral sex on a beautiful vagina without dental dam. So we can have oral sex with protection, which of course isn't ideal, but at least we can still be intimate that way. Now, there's evidence the transmission of the virus can happen not just through respiratory droplets, but also through the saliva of an infected person. And that, of course, puts kissing in a very high-risk sexual activity. So no kissing. Wow. That is a tough one, because kissing during sex, or even without sex, kissing is like the sauce that goes with the spaghetti. You know, if kissing is not part of it, then something is just missing. I'm pretty sure we can all relate to, or we all have experienced a time when we were intimate with a partner and we couldn't kiss for one reason or the other. Either they were a back kisser, or they had a cold sore, or just had a sore throat and you didn't want to catch anything, so you refrain from kissing, and something is missing. So that is a tough one, but you know, it's just the time we're living in, and it just represents, like I said, this new frontier of sexual behavior. As you can see, our sexual behavior is being forced to change. Not necessarily for people who are in a mutually monogamous relationship and they live with their partners. You can continue having the kind of sex that you have been having, as long as you trust each other and as long as you're not infected with the virus, of course. and you can just, have the sex that you can have, and have it for the people who are not able to have the sex. So you can also improve on some of the activities that you're doing, but that's going to be in another video. So, like I mentioned, abstinence does not work. People will have sex even if they're told they shouldn't. I mean, we saw it with the AIDS virus. So I think it's important that we have guidelines, so we know exactly what is the smart thing to do, what is a low risk thing to do, what is a high risk thing to do, and how can we still be intimate without putting anybody at risk. So I put these guidelines together on a couple slides this is for the people who are in a partnership but don't live with their partner, or are looking for a potential intimate partner. So here are the slides.
First, I want to give you a list for prep before sex. Shower, wash your hands and the body with soap and water before and after sex. Use soap and alcohol, the wipes, to clean the area where you have sexual activities. If it's on a countertop, wipe it down first. Bring an alcohol-based hand sanitizer. That should always be present. Wash your sex toys before and after using them, and do not share them. This is something that who owns sex toys has been doing it hopefully all along. Here are 3 guidelines to help you choose a sexual partner. Avoid sexual partners who have symptoms of COVID-19. Don't take their word for it. If you feel like they have symptoms, don't. Go with a consistent sexual partner. Be selective in finding them, so you can limit your physical interactions by reducing the number of sexual partners you have overall and or at the same time. This new sexual frontier could possibly push us into monogamy, and there's absolutely nothing wrong with it. Monogamy is a beautiful thing. It can be a very beautiful thing. And here are the guidelines for sexual activities. Avoid kissing or exchanging saliva with anyone outside of your household. Avoid sexual behaviors that involve semen or urine. Avoid sexual activities which include licking around the anus, but you can use condoms or dental dams to reduce contact with saliva or poo. And you can use condoms and dental dams during oral and anal sex. Now, wear a mask during sexual activity. This could be very exciting and different. You can focus on their eyes, and it will keep your hands out of your face, and you will not be tempted to kiss. And this new frontier of sexual activity may push us to the outdoors. Pick larger, more open and well-ventilated spaces. Go outdoors.
Well, that wasn't too bad, was it? It's just the times we're living in, and we're being given lemons, so we have to make lemonade out of this, and we have to look at it as a new frontier of sexuality. And monogamy is a beautiful thing, and it can be a beautiful thing if both parties are really into each other, and if they believe in it, and if they think that they can really work on their sexuality and have a wonderful time with it. That would be a way to go. And if you're not in a monogamous relationship, and if you're looking for a partner, please be selective. Pay attention to what that person's disposition is towards the virus, what their overall health is like, and just limit your new sexual partners as much as possible. Like I said, this is not the end of the world. We can get through this, and in the meantime we just have to really live by these rules and act by these rules to keep ourselves and others safe. So do what you can, have a wonderful time, be safe, and I'll talk to you next week. Bye.